Welcome back to my channel. Today I'm going to discuss about OET Reading Part A. In OET Reading Part A, you get total 4 tests. In this 4 tests, you get total 20 questions. You have to find out answers in this test. Today, I would like to give you an important suggestion about OET Reading subtest module. It is very significant module in this part. Apart from that, I have seen most of the students are not getting enough mark in OET reading subtests. Do you know what is the reason behind that? My experience, I can say that you people are not doing correct method, not following the correct method. Additionally, I would like to ask you one question about this module that how many mock tests have you done before the OET exam? How many mock tests have you done before the OET exam? During that test, if you didn't get enough mark, that is more than 70 to 20 in OET reading subtest, it is very difficult to get very difficult to pass OET reading subtest. So think yourself, have you done enough mock tests before the exam? Let's begin today's topic, that is a fracture, dislocation and sprains. This is one of the samples I have taken from OET official website. Sometimes you will think, yes, this test I have done before, but the fact is not like that. Okay, here you are going to get some tips and tricks. Maybe you have done this test before, but uh, in this module I am going to give you some tips and tricks to get 20 out of 20 marks in OET reader subtest. If you get 20 out of 20 marks in part A session, definitely you will get sufficient score in OET reader OET subtest. Your aim should be 18 to 20 marks in OET reading part A and 4 to 6 marks in OET reading part B and 10 to 12 marks in OET reading part C. If you get if you can achieve these marks, definitely don't worry about your OET reading subtest. Let's begin today's topic. Okay. When you get the question paper, this is the question paper, this is the question paper. Okay, when you get the question paper, the question number first 7 questions will be the match the following, then short answer questions till 14 and 15 to 20 there is a sentence completion question. Okay, so what you have to do, it is better to start from question number 8. Okay, and second, okay, this is one tick. Second one is here test A. Test A. These are the titles. There is no need to read all the sentence. Okay, just you have to read the titles. Test A is discussing about fracture, dislocation, and sprain, and you will get pencil. Okay, so you have to write somewhere in the question paper, not here. Here there is a small space. Small test A, sprain, dislocation, and what is that? And fracture. Okay, fracture. And test B, test B, and immediate management, assessment, and management. Okay, test B is management. Test B, management and assessment. Test C. Test C is drug therapy. Test C is drug therapy. And test D is talking about technique floor plaster back slab. Okay, technique uh, plaster plug. This much information is enough to do this test. Okay, don't there is no need to read all the passage. Okay, now when we are doing the questions, we will read. Okay, we will do the skimming and scanning method. Okay, in this method you can find out the answer correctly. Okay. Now you have to keep it in your mind. What are the information you have to find out in the past? Test A is the fracture, sprain, dislocation. B is management and assessment. C is drug therapy. D is plaster, use of plaster, Paxilabs. Okay, this much is enough to do this test. Okay, then when you are doing the practice session, it is very necessary to manage your time. Okay, so don't give 15 minutes. Okay, our test will be we have to complete these 20 questions within 15 minutes period. Okay, so when you are doing the practice session, do practice within 30 minutes. Try to complete your questions within 30 minutes. If you can achieve, if you can do 20 questions within 13 minutes, it will be very good achievement. Okay, so during the examination, definitely it will help you. Okay, then you have to third tips, you have to underline the stem of the questions. Okay, that we will call it as a keyword. You have to underline stem of the questions. Okay, and you have to understand what the question is asking. Sometimes some questions will be very tricky questions. Okay, maybe that time you will spend too much time to find out the answer. Okay, if you are not getting the keyword in the passage, your answer is not there. It is a waste of time. You are finding the answer here and there. It's a waste of it. You will get the keyword, then the answer is there. Okay, got it. If you get the keyword in the passage, the answer is there. We are not getting the keyword in the passage, the answer is not there. Okay. So, first question, what should be used? What should be used to elevate patient's fractured leg? Okay. So, when you are doing the question, when you are doing the OET Reading Part A, underline the keyword. It is very, very important. We are human beings. Okay. There is a chance of getting forget. Okay, when we are doing this, so it will definitely find out the answers correctly. Okay, sometimes more ways you will miss. So underline the keywords. Very, very important thing. You have to underline the keywords. Okay, what should be used to elevate a patient fracture leg? Okay, here elevate fracture leg. So where you have to go? So here we have written something here. Okay, so first one is a fracture, dislocation, sprain. B is management and assessment. C is struck therapy. D is taking the plaster backside. Then where we will go? When doing this, when doing this, definitely we can find out the location. So the location, what should be used to elevate patient fracture leg? So it will be in the management. Okay, so then where we have to go? We have to go in the B, test B. Okay, we are going to test B. You are going to do skimming and elevate fracture leg. Okay, these are the two keywords: elevate, fracture leg. You have to do the skimming and okay, here is the assessment. Fracture leg. Okay, well, fracture leg, then we have to do the management. Okay, fracture leg. Okay. Mm. See, fracture leg means a leg. Elevate. Okay, what is the question? What was the question? What should be used to elevate? We got the elevate and fracture leg. Okay, elevate we got here, fracture leg. Okay, leg we got, what we use? A pillow. Then what is the answer? What is the answer is pillow. Got it? You have to write pillow here. Okay, pillow. Got it? Got it? How many people got it? Pillow. Okay, got it? This is the type. Okay. Next question. What is the maximum dose of morphine per kilo? One keyword. Okay. For of a patient weight, kilo of a patient weight can be given using intramuscular route. Okay, another keyword. So where we have to go? So see, here we have written C is the drug therapy. So we have to go to C. What is the maximum dose of intramuscular? Here intramuscular we got maximum dose per kg. Minimum is 0.1, maximum is 0.2 milligram. Okay, so then what is the maximum dose? Maximum dose of morphine per kilo of a patient weight that can be given using the intramuscular to 0.2 milligram. Okay, 0.2 milligram. Okay, got it? Got it? Maybe you have done this test before. Okay, no problem. Watch this again. You will get something extra. Okay, you will get definitely, I can give you something 1%. 1% will increase your 1 mark. You can achieve 350 marks. Sometimes some people are getting 340 marks. Okay, 340. So here we can achieve 350 marks. Okay. Which parts of a link may need extra padding? Which parts of a limb need extra padding? Where we have to go? Which parts of limb need extra padding? So maybe here first one is B is management, D is plaster. So first we will go to management, then after we will go to plaster D. Okay, which part of a limb need extra padding? So we will here we will check it here. We'll do the skimming and scanning. Okay. So it is not there. Extra padding. See, extra padding can be placed over bony prominence. Okay, so I told you if it is not there in the B, we have to go C. Okay, first B is also talking about management. Okay, if it is not there, you have to go to D. Okay, so in the D test D, it is here extra padding keyword. We got the keyword here. What are the keywords? What are partial limb may need extra padding. Okay, limb. Limb means bony prominence is a limb. Okay, where we need extra padding can be placed over bony prominence. Okay, got it. What should be used to treat a patient who suffers respiratory depression? Okay, here again is talking about the treat. What should be used to treat patient who suffers a respiratory depression? Okay, what should be used? Okay, it is talking about medication. Okay, so we have to go to medication. If it is a respiratory depression, see respiratory keyword is here. What should be used? Naloxone. The keyword is not there, you won't get the answer. Keep it in your mind. Okay, keyword is not there, you won't get the answer. Okay, got it? Naloxone. Then what is the answer? Here you have to give right naloxone. Naloxone, okay? Naloxone. Here bony prominence, okay? Bony prominence, okay? What should be used to cover a freshly applied plaster? What should be used to cover a freshly applied plaster backslash? So where you have to go? So plaster backslash is D. Okay, you have to go to D. Freshly, what should be used to apply? Freshly prepared plaster backslash. Okay. What should be used to apply? Mm, cover. Okay. Crepe. bandage family around plaster bus. What should be used? Crepe bandage. Okay, you got it. Crepe bandage. We have to use crepe bandage, especially apply plaster baxilla. Okay, you got it. Crepe bandage. Okay. Then we have to go to next question. What analgesics, again medication, should be given to a patient who is allergic to morphine? If it is allergic to morphine, what analgesics? Okay, again medication, you have to go to medication. Allergic to morphine, what? Allergy morphine. If there is anybody is written allergic to morphine, okay, allergic, okay, it is not written, okay, it is not there, then you have to go to management, okay. If it is, see here, administer analgesic to patients severe pain if not allergic to morphine. If allergic to morphine, use fentanyl. What is the answer? Fentanyl, okay, okay, fentanyl. What condition might a patient have if severe pain persists after splinting, elevation, and repeated analgesia? What condition might a patient have if severe pain persists after splinting? After splinting, severe pain, elevation, and repeated analgesia. So it is in the assessment. Okay, so go to assessment. That is in the B. Okay, consider, see, immediately I can see is consider compartment syndrome where pain is severe. Keyword is here, and relieved by splinting and elevation. Again, keyword is here. Okay, what are the keywords? Splinting, elevation, repeat analysis, severe pain. So what is the condition? Compartment syndrome. What is the condition? Compartment syndrome. Got it? Next question. Next short answer type of questions. 15 to 20. Uh, uh, 15 20 short answer type of questions. Okay. Falling on an outstretched hand is a typical cause of a dash of elbow. Falling on an outstretched hand is a typical cause of a dash. Then where you have to go? Say yeah, yeah is talking about fracture, dislocation, and splint. Okay, so you have to go to there and part A, falling from an outstretched hand. See, outstretched hand, we got keyword. Okay, falling, we got another keyword. That is what is the condition? Dislocation. What we have to write? A dislocation. Okay, dislocation is the answer. 16. Upper limb fractures. Upper limb fractures. Upper limb fracture. What are the upper limb? Upper limb is our uh, hands. Okay. Upper limb fractures should be elevated by means of a dash. Upper limb fracture. So you have to where you have to go. You have to go to the management. Upper limb fractures can be elevated. Okay. See, elevate upper limb fractures elevate. Arm injuries. Arm means upper limb. Yes, sling. Okay, what is the answer? Sling. Okay, got it. We have to write sling here. Okay, upper which should be elevated by means of a is a given. Then we have to write sling, only sling here. Okay. Make sure the patient is not wearing any dash on part of the body where the plaster box is going to be placed. Here, plaster box lab, it is in the part D, test D. Uh, Patient is not wearing any. That we have to find out where plaster box lab is placed. So go to D and find out which one it is not. Ensure any jewelry is removed from the injury. Ensure that means not wearing any. Ensure then what is the answer? Make sure patient is not wearing any jewelry. Okay, any jewelry on the part of the body where the plaster patch slab is going to be placed. Okay. Check to see whether swollen limbs are or increasing in size. Where you have to go? You have to go to the assessment. Okay. Or where we have seen the assessment in the part B. Check to see whether swollen limbs are uh, or limbs are dash or increase in size. Okay. Check to see swollen limbs are uh, Swollen limbs are increasing in size. Okay. See, we got one keyword getting bigger. Okay, swollen limbs are increasing in size. We got what is the another word they are beating? Words are throbbing. Swollen limbs is throbbing. Limbs are throbbing. Then what is the answer here? Throbbing. Okay, got it? Throbbing. Okay, you can easily find out the answer if you follow my technique. Definitely, you can achieve 20 out of 20 in OET reading part A session. Okay. In a plaster backslab, there is a layer of dash closer to the skin. Okay. Plaster, we have to use something, a layer of dash. Okay. Then go to D. Measure a length of non-compression cotton just below the elbow. Okay. Okay, forearm. Okay, what is the question? In a plaster backslab, when during plaster backslab, there is a layer of dash closer. There is a layer of cotton stockinette. Okay, then what is the answer? Cotton stock. Layer of cotton stockinette. What is the answer? Otherwise, you can write cotton padding. Okay, you can write stockinette or cotton stockinette. Okay, got it? Patient aged dash and cover shouldn't be given the higher dosage of pain relief. Okay, patient aged here again asking the age means shouldn't be given higher dosage of pain relief. Then where we have to go? We have to go to the medication that is in the part C. Use a lower end dosage range of patients less than greater than 17 years. What is the question? Patient aged 70 and over. So here it is given 17 or equal to more than 70 or equal to 70. Then what do you have to do? Write 70 years. Okay, got it? You have to write 70 years here. Okay. How easily you are getting the answer? It is a technique. Okay, it is a technique you have to follow when you are doing the OET ready subtest. Okay. Now we are going to find out the match the following question. It is a very easy task of OET ready subtest. So, uh, see some points here you have written. Okay, A is brain fracture dislocation, B is medication, B is management and assessment, C is medication, D is plaster backslap. Procedure for delivering pain relief. Okay, you can easily write C is okay. Procedure to follow when splinting a fractured limb. Where is the what is the procedure to follow when splinting a fractured limb? What are the procedures to follow when splinting a fracture? What are the procedures we follow? Splinting a fractured limb, measure length or non-cotton, wrap cotton, measure. These are the procedures you have to follow when fracture is splint. Okay, so then what is the answer? D. Okay, got it. What to record when patient when assessing a patient? Where we have to record assessment? Where is the assessment? Is in the B. Okay, so you have to write B here. Okay. The terms used to describe different types of fracture. What are the terms? Terms are fracture, dislocation, and sprain. These are the terms. Okay, then what is the answer? A. Okay, got it. The practitioners who administer analgesia medication. The practitioners who administer analgesia. Analgesia, it is talking about analgesia. The practitioners. So if it is, you have to check it. If it is C or sees the medication practitioner authorized um, who administer authorized indigenous health worker must consult medical officer or nurse practitioner should medicine oral listeners. Then what is the answer? Answer is what is the answer? Answer is C. Okay. How to look for when checking what to look for when checking an injury. Then assessment, again assessment. Where is the assessment? It is in the what to look for. What to look for? Color of the whole limb. Okay. perform physical assault, painful animals is swelling. What to look for? Then that is the B. Okay, got it? But this is the B. How fractures can be caused? How fractures can be caused? Here, buckle or breaking the bone. How fracture can be caused? Okay, it is in the A. So easily got within 13 or 12 minutes we can complete part A completely. Okay, this is the method you have to follow when doing OET reading part A session. If you are getting 20 after 20 in OET reading part A, there is no need to worry about OET reading subtest. Try to get 20 after 20 in OET reading part A session. Okay, this is very important module in OET reading subtest. So today signing as Sanita. Thank you. For online coaching, please contact me on 9540382056.